Time now for our weekly partnership segment with our friends over at The Lever. Joining us this morning is David Sirota. Great to see you, sir.
Good to see you.
Let's put your latest reporting up here on the screen. I'm really glad you covered this because this is something I've been wanting to dig into. Your headline here is health insurers get government cash, then jack up prices. Despite the Affordable Care Act's promises, publicly subsidized insurers are jacking up prices while Americans lose coverage. And David, one thing that we noted this week is, we got the new inflation numbers, which continue to be bad in a lot of categories. One of the categories where we saw the highest price increases was in health insurance. So it seems to me like you're telling a really important piece of the story here that I haven't seen covered really anywhere else.
Yeah, well, it's a huge story. I'm glad we start on the inflation question. There's all this talk that inflation is driven by supply chains and products, et cetera, et cetera. Health insurance is notoriously an industry of paperwork. It does not really have supply chains. So there's this debate, is inflation about supply chains, or is it about oligopolies and monopolies using their market power to just jack up prices, using inflation as an excuse to pad their profits? So here's a perfect example of an industry of paperwork that doesn't have supply chains, an oligopolized industry of a few giants controlling lots and lots of markets, just jacking up their prices by 24% in a single year. That, to me, is proof that at least that part of the inflation crisis is just companies deciding to say, hey, we have lots of market power, we don't have real competition, and we can just turn up the prices and squeeze people for more. Now, our reporting shows that 6 of the 7 major health insurance companies are now making the majority of their revenues from the government. That's according to former health insurance executive Wendell Potter, who did the research. And so you put these 2 points together. The government, we the people, are subsidizing the insurance oligopolies, who are then turning around and rewarding us with 24% year-over-year price increases.
So the other piece of this is the fact that when he was campaigning, and especially in the Democratic primary, President Biden, then candidate Biden, was under a lot of pressure from Bernie Sanders and others to put out some sort of a health care plan that could compete with the vision of universal coverage under, say, a Medicare for All program. And so what he campaigned on was, hey, we're going to go back to the original idea of a public option that can compete with this. And since he's been in office, they've also been pushing this idea of let's further subsidize health insurance so that more people can afford it and will effectively get to guaranteed coverage that way. However, as we face down a critical midterm election with more Americans, as you put it, being inadequately covered and some being pushed down of health insurance altogether, we have heard really nothing about what the Democratic Party might do if they keep power with regards to health insurance or health care in general. Tell us a little bit more about that piece.
Yeah, I mean, it's really crazy. Healthcare, it feels like it's gone from the political agenda, gone from the election conversation. Biden campaigned on a promise to create a public option, a government-sponsored health insurance option to compete with private insurers. The Congressional Budget Office has said that if structured properly, it would create the kind of competition that would reduce premiums, put downward pressure on that, for instance, 24% price increases that we've seen year over year under the current system. Since becoming president, he has not mentioned the public option even once, not once. The major policy proposal that Democrats have put forward is, as you say, more subsidies to ACA exchange plans and the like, essentially shoveling even more money at the insurance companies, which, of course, again, are using their market power to simply jack up prices. The point being, you cannot solve this problem, this cost of living problem, because this is part of cost of living, obviously. You cannot solve that problem by simply throwing more money at it and doing nothing else. You have to do something different. But unfortunately, the Biden administration and the Democrats don't seem interested in even having a conversation about what could be done. And there are plenty of things that could be done. The public option could be done. Some forms of Medicare for all could be discussed. I mean, there are many things that could be done, but a lot of health insurance money goes to the Democratic Party. It is a big base of support for the Democratic Party. Joe Biden's first fundraiser in 2019, when he announced for president, was with the CEO of one of Blue Cross's major affiliates. That's how tightly woven in the health insurance industry is with the Democratic Party, and explains why, amid a very real healthcare affordability crisis, 2 in 5 Americans are either uninsured or underinsured. That's why you don't see, in my view, you don't see real policy prescriptions being put forward by the Democratic Party leadership.
This is part of something actually Senator Sanders critiqued in The Guardian, which is the fact that, for Americans, overwhelmingly, they tell pollsters their number one issue is the economy and inflation. Yet Democrats have effectively completely ceded that issue to Republicans. 100% of their messaging is around abortion or close to it. And listen, I'm on their side on abortion. I think it's an important issue. I'm not trying to say it's not. But when you have voters overwhelmingly saying, this is the thing that I'm voting on and that I care about, you should probably be offering some solutions that are actually going to be able to help them out on economic matters. The other piece, David, I wanted to get from you, for people who don't understand this piece, there's this thing called Medicare Advantage, essentially like a privatized version of Medicare that has grown increasingly, large and important in terms of our overall health insurance ecosystem. Could you help people understand what that is and how that plays into this overall story?
Sure. The Trump administration kicked off, really accelerated, and the Biden administration has continued to accelerate the push of seniors, Medicare recipients, off of traditional Medicare into privatized, privately administered Medicare Advantage plans. These plans often have high rates of denial of care, of necessary care, according to a federal report. And the cost of these plans are huge. They are costing, their reports of billions and billions of dollars of cost overruns. Obviously, another gift to the health insurance companies. This is why so much of the health insurers' money, the revenues they're making, are from the government. I go back to the Affordable Care Act. The Affordable Care Act was sold to Americans as a way to preserve the privately financed health insurance system and reduce costs for Americans. Now we have a system where 6 of the 7 largest health insurers are mostly publicly financed, even though they are privately administered, and healthcare prices keep going up. And again, part of that is because so many people are being funneled into Medicare Advantage plans. And of course, part of that is because there's the government's only solution that they're offering is let's subsidize ACA plans. Let's throw more money at the health insurers to do ACA plans, but it's not actually necessarily expanding medical care. The health insurers are psyched. They're making huge profits. The rest of us, it's not such a great story. It's really the Unaffordable Care Act.
Yeah, classic story. Socializing the cost and privatizing all of the profits is exactly what we're doing here. David, thank you so much for your reporting on this. Great to see you. Everybody go subscribe to The Lever if you are able. They are doing work that no one else is doing in digging into these stories and exposing corruption on both sides of the aisle. Great to see you, my friend.
Great to see you. Thanks so much.
Yeah, of course. And thank you guys so much for watching. We'll have more for you later. Cable news is ripping us apart, dividing the country, making it impossible to function as a society, and making it impossible to know just what is true and what is false. But the good news is they are failing and they know it.
That is why we're building something new, a new mainstream, a healthier one, something more trustworthy, something that we are going to need in one of the most pivotal times in American history. We are building up here for the midterms, for the upcoming presidential election, but we need your help. So if you can help us out by becoming a premium member today at breakingpoints.com, we're trying to change America for the better and the entire world.
So what are you waiting for, guys? Go to breakingpoints.com and sign up and help us build a new mainstream.